Psychiatric coding is a fundamental process in behavioral health. It involves translating a patient's diagnosis and the services they receive into universal alphanumeric codes. These codes are essential for clear communication between healthcare providers and insurance companies. Think of coding as the language that explains why a service was necessary and what specific service was performed. Without this standardized system, billing for mental health services would be chaotic and inconsistent. It ensures that every provider, regardless of their location, is speaking the same administrative language, which is crucial for the smooth operation of the healthcare system. The importance of accurate coding cannot be overstated. For providers, correct codes are the key to receiving proper and timely reimbursement for their valuable work. Inaccurate codes can lead to claim denials, payment delays, and even audits, which can be both time-consuming and costly. For patients, precise coding is just as vital. It creates an accurate medical record that reflects their health journey. This record influences future treatment decisions and ensures that the care they receive is covered by their insurance plan. Proper coding justifies the medical necessity of the therapy provided, protecting both the patient and the practitioner. This system is built upon two main pillars: the International Classification of Diseases, 10th Revision, Clinical Modification, or ICD-10-CM, and the current procedural terminology, or CPT codes. The ICD-10-CM codes are used to identify the patient's diagnosis, such as major depressive disorder or generalized anxiety disorder. The CPT codes, on the other hand, describe the actual services rendered, like a psychiatric diagnostic evaluation or an individual psychotherapy session. Using these two systems together paints a complete picture of the patient encounter for billing and record-keeping purposes. Ultimately, mastering psychiatric coding is an investment in the quality of care. It supports the financial stability of a practice, allowing clinicians to focus on what they do best, helping patients. It also ensures that patients' medical histories are documented with precision, which is essential for continuity of care and effective long-term treatment planning. When coding is done correctly, it builds a bridge of trust and transparency between the provider, the patient, and the payer. This foundation is critical for a healthy and functional behavioral health practice in today's complex healthcare environment. The ICD-10-CM code set provides a detailed system for classifying diseases and health conditions. In psychiatry, these codes are used to specify a patient's diagnosis. It is important to be as specific as possible when selecting a code. For example, instead of using a general code for depression, a clinician should use a more precise code that indicates if it is a single episode or recurrent, and its severity. Common codes in the F chapter of the ICD-10-CM manual, which covers mental, behavioral, and neurodevelopmental disorders, are frequently used. These codes provide the medical necessity for the services rendered. One of the most frequently used categories is for mood disorders. Major depressive disorder, for instance, has codes that differentiate between a single episode, which is the F32 series, and recurrent episodes, which is the F33 series. Within these, further specificity can be added for mild, moderate, or severe cases, and whether there are psychotic features. Similarly, bipolar disorder is coded using the F31 series, which distinguishes between the current episode being manic, depressed, or mixed. Correctly identifying the specific nature of the disorder is crucial for accurate billing and effective treatment tracking over time. Anxiety disorders are another common area in psychiatric coding. Generalized anxiety disorder is coded as F41.1, while panic disorder is coded under F41.0. Social anxiety disorder falls under F40.10. For patients dealing with trauma, post-traumatic stress disorder or PTSD is coded as F43.10. Each of these codes represents a distinct clinical picture, and using the correct one ensures that the patient's record accurately reflects their condition. Unspecified codes like F41.9 for anxiety disorder unspecified should be avoided whenever a more definitive diagnosis can be made. Finally, Z codes are an important part of the ICD-10-CM set. These codes are not for diagnosing a disorder, but for reporting factors that influence health status or contact with health services. For example, Z63.0, which stands for problems in relationship with spouse or partner, can be used as a supplementary diagnosis in couples therapy. Z codes help to provide additional context about the patient's circumstances that may be affecting their mental health. Using them correctly adds a layer of detail that can support the medical necessity of the treatment being provided to the patient. While ICD-10-CM codes explain why a patient needs care, CPT codes describe what care was provided. In psychiatry, many of the most common CPT codes are time-based. This means the code you select depends on the total duration of the service. The first key service is the Psychiatric Diagnostic Evaluation, coded as 90791 if there are no medical services, or 90792 if medical services are included. This initial assessment is typically performed once at the beginning of a new treatment episode to establish a diagnosis and create a treatment plan. It is a comprehensive service and is not time-based. For ongoing psychotherapy, the codes are based on the length of the session. The primary codes for individual psychotherapy are Media Group, CPT code chart highlighting 90832, therapist in 30-minute session, add at stock, add at distribute _equally, 90832 for 30 minutes, 90834 for 45 minutes, and 90837 for 60 minutes. The times listed are technical midpoints. For example, 90832 is used for sessions lasting 16 to 37 minutes. It is essential for clinicians to document the exact start and stop times of the therapy session in the patient's record. This documentation is the evidence needed to support the chosen code in the event of an audit, ensuring compliance with payer rules. Psychotherapy can also be delivered in other formats. Family psychotherapy sessions are coded using Media Group, CPT code chart showing 90847, family therapy with patient present, add at stock, add at distribute _equally, 90847 if the patient is present, and 90846 if the patient is not present. Group psychotherapy is reported with code 90853. These codes are not time-based. They are reported once per session, regardless of the duration. For crisis intervention, two specific time-based codes are available. Media Group, CPT code chart, highlighting 90839, crisis intervention session at its stock, at distribute _equally, 90839 for the first 60 minutes, and plus 90840 as an add-on code for each additional 30 minutes. These codes are reserved for urgent situations where a patient requires immediate therapeutic intervention for a severe mental health crisis. When psychotherapy is provided on the same day as an evaluation and management, or EM service by a psychiatrist or other qualified medical professional, add-on codes are used. The codes: Media Group, CPT code chart showing plus 90,833 medical bill with add-on code add at stock, add at distribute _equally, plus 90833, plus 90836, and plus 90838 correspond to the time spent on psychotherapy, 30, 45, or 60 minutes respectively, and must be billed alongside an appropriate EM code. Understanding these different CPT codes is vital for accurately reporting the services provided, whether it is a standard individual session, a family meeting, or a complex crisis intervention, ensuring the practice is reimbursed correctly for its work. Accurate coding is only as strong as the clinical documentation that supports it. A patient's record must tell a clear and complete story of their care. Every note should include essential elements such as the chief complaint, a confirmed diagnosis with its corresponding ICD-10-CM code, and the type of therapy provided. Most importantly, for time-based codes, the documentation must specify the exact start and stop times of the psychotherapy session. This detail is not optional. It is a strict requirement for compliance and is often the first thing auditors look for when reviewing claims. The clinical note should also describe the patient's progress, or lack thereof, toward their treatment goals. This narrative demonstrates the ongoing medical necessity of the therapy. A well-documented record will detail the therapeutic interventions used during the session, the patient's response to those interventions, and any changes in their mental status. It should conclude with a clear plan for future care, including the planned frequency and duration of upcoming sessions. This comprehensive approach creates a golden thread that connects the diagnosis, the treatment, and the plan, justifying the services billed. To maintain compliance, providers should follow a few simple rules. Always code to the highest level of specificity. For example, use F33.1, which is major depressive disorder, recurrent, moderate, instead of the less specific F33.9, major depressive disorder, recurrent, unspecified. Sequence codes correctly by listing the primary reason for the visit first. Furthermore, only code for conditions that are actively being managed or treated during the encounter. Staying current with payer policies is also crucial, as different insurance companies may have unique rules or requirements for certain codes or modifiers. Ultimately, good coding practices are about more than just getting paid. They are a reflection of a provider's professionalism and commitment to ethical practice. By keeping meticulous records, matching documentation to the codes submitted, and staying informed about coding guidelines, behavioral health providers can protect themselves from audits and penalties. More importantly, they uphold the integrity of the patient's medical record, which is the cornerstone of high-quality care. Diligent coding and documentation are essential skills that support the sustainability of a practice and the well-being of its patients.